So in class, we talked about motion present and motion permitted. Motion present was both hands listening and sensing the inherent motion that's able to express itself through the leg or the knee or wherever we're practicing that. Motion permitted is exploring the range of motion from biomechanic range of motion to the tissue range of motion to the fluid range of motion and more subtle ranges of motion in the membranes and the ligaments. So with motion permitted, we have one hand listening and one hand doing. And what we're doing, wherever we are, we're still following the principles. The principles of trust the health, be present, embodied wholeness, get there by practicing inclusive attention, and then the third principle is going to be finding ease. So one of the important things is what I'm going to be checking is I'm not going to do motion present. I'm just going to assume that we have some good flow through the leg here, okay? But just because we have flow doesn't necessarily mean that the biomechanics in the tissue are lined up according to the blueprint and where there's most ease, and ease has most stability and adaptability. So I'm going to be checking the range of motion, how the tibia and the femur relate, okay? So one of the important things is where is my hand position? Now I have long arms and long hands, so this is my preferred way to align the knee. And I'll show you another way from the side here in a moment. So one of the important things is in the foot, the lateral arch is on the anterior end of the calcaneus, and that's support. So if I can put my hand so I have the lateral arch and part of the calcaneus, then I can control the femur. If I include the medial arch, then the medial arch is supposed to be adaptable and move. So I'm not going to be able to check and see how that line is up through the knee. So that's an important thing to start out with. So I'll have the lateral arch and the base of my hand at the calcaneus. And so this is going to be my doing hand, and my listening hand is going to be up right at the knee or just a little bit above it, but sensing the movement through the knee. So I have the lateral arch and the base of my hand, the calcaneus, and here I'll put a little bit of pressure up into the dorsiflex, the foot, because we're talking about going into weight bearing, so the foot is going to want to be dorsiflexed. So this is going to be a little more pressure than we may have explored in class. So the knee is going to be an extension, and then I can test and see, like, I could test what's the range of motion. I could just see how the hip is. You know, what does it feel like? It feels strained right through here. Okay, I can then get the hand position, get the lateral arch and the heel, and I can then move the tibia underneath the femur. And what I'm going to be looking for is where the barriers are. So if I take Gail's leg and go medial, there's a hard barrier there. If I go lateral, there's a softer barrier. It's like barrier, 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 and there's the end. Okay, so there's a lot more laxity in that. So in between those two barriers is where I'm going to look for ease. So I'm going to go medial, and then I'm going to start going lateral really slowly until I feel the back of Gail's knee now is starting to expand into my hand. And then when I find that, I wait, and now I go and shift to two listening hands. And I wait, and I wait. I'll do a little micro movement to keep searching for the ease and synchronizing with the ease. Doing little micro movement. Now I wait again, and then I have both listening hands, and it feels like her leg is getting longer. The back of the knee is getting, I'll say, wider. It feels like there's a length coming down through the posterior part of the lower leg. Okay, and I wait and wait and wait, and there it stops, and now it's stopping, and I'll call that good for now. So then I can go and check again, and the range of motion between the hard barrier and the soft barrier is a lot narrower. It's a lot narrower. In fact, what used to be the hard barrier laterally, or excuse me, the soft barrier laterally is now more firm. Okay, so then I can check again. So the range, the amount of motion between those two barriers is a lot smaller now than it was initially. And so I do the very same thing. I have a doing hand on the foot and a listening hand up by the knee. And I just very subtly, very slowly, there we go, there's ease there. And now I'm feeling length go up the back of the leg, up through the hamstrings and down through the calcaneus, and the leg is lengthening. And whenever we have lengthening, that's always a good sign. So our bodies get compressed with anything else. So then I can come back and I can check again, and now the range of motion is very slight. So I want to show you a side position. If you don't have long arms and bigger hands, we can still do the same thing from the side. Again, I want to be able to have the lateral arch so I can control the leg. Okay, so I have a doing hand and I have a listening hand, and so then I can do that motion, only way more subtly. I can move the knee, move the tibia underneath the knee, and since I've already worked with this, that range of motion between the hard barrier and the soft barrier, or between the two barriers, is really small now. But this is give you an idea about if you have smaller hands and shorter arms, how you can still work with this. And then what I would do is I would finish and integrate. And integrate with listening. So then I shift from motion permitted, which is one hand doing, one hand listening, to motion present, which is two hands listening, and I wait and I notice and just wait and see what kind of inherent motion can be expressed. And hopefully what will happen is you'll start to get a sense of flow here and flow back. And if you experience that, then that's good for now.